As the holiday song goes, it's the most wonderful time of the year.
But holiday parties and big family meals can also make for a very unpleasant illness, food poisoning. CBS 2's Dr. Max Gomez tells us what to do if you get the dreaded stomach flu. Doc.
Well, you know what? Let's start out with there's no such thing as stomach flu. It's called gastroenteritis, and it's not caused by the influenza virus. It's caused by many other viruses, bacteria, and parasites that can contaminate food. And most of them can make you feel sicker than almost anything else you can catch. Just ask this woman.
I was very sick. I had an extremely bad headache. I was weak. I was vomiting for a couple of days.
That's Lori Balzano's description of her bout with a stomach bug, and she wasn't alone.
It had another family member also.
It's going around.
It was definitely going around, and then I heard there were 2 other people at work.
Turns out there are cases of gastroenteritis, stomach bugs, going around.
We actually are seeing an uptick in this, and this is what we would expect actually this time of year.
This kind of serious stomach illness is often called food poisoning because the germs that cause it are usually foodborne. Everything from salmonella and E. coli to hepatitis. But by far the most common is a nasty virus called norovirus. Just a few virus particles are enough to get you sick. And it's extremely contagious because in addition to food, it can be passed along person to person. Contaminated hand to clean hand contact, and contact with any bodily fluids from a sick person. Unfortunately, there's no cure or quick fixes, just supportive care.
We recommend fluids that sometimes have salt or glucose or sugar, and this would include products like Pedialyte or Gatorade, things of that nature that have some electrolytes, sodium, potassium, because when you're having vomiting diarrhea, these are things you lose.
While most people like Lori get better after a few days, some people may need medical care.
You feel like you're almost on the verge of passing out, your heart rate's fast, you feel like your pulse is thready. These are signs where you need to go to the hospital and seek further treatment, or even call your doctor.
And if there's any blood in what's coming out of you, that's another sign to go to the hospital. Finally, there are some folks who have to be especially careful if they get a stomach bug. The elderly, babies, the chronically ill or immunocompromised, they're much more susceptible to dehydration. And the #1 way to prevent getting sick?
Yes. Wash your hands.
Wash your hands.
Wash your hands and wash your hands and then wash your hands some more. Right. That's how it really gets transmitted, hand to hand. Anybody who's sick should never be preparing food. That's another thing.
Yeah, you know, the doctor hinted at it. He said, you know, with Pedialyte and a few other things, but it would seem, and it certainly seems in these situations, there's nothing that makes it any better once you're sick, right?
No. This will just prevent you from getting much
worse.
It's not going to speed anything up, unfortunately.
Yeah, it's tough, right?
Yeah.
It's nasty, whatever it is.
Nasty.
Nasty. It is.
Thanks, Doc.
We've all been